The next challenge in the aortic world is the repair of the arch. And we now have a couple of devices with three branch options. So total endovascular repair of the arch. And we have proposed a percutaneous approach to have a really less invasive approach or minimal invasive approach. Now the future will probably type A dissections. We still don't know if there's a role for endovascular. But it seems that there's a lot of R&D going on, and probably in the near future we will be able to do endo-Bentall repairs, and probably acute type A dissections will be a subgroup of patients that will benefit from this new technology.
I'm really looking forward to Charing Cross 2022 in Lisbon. Certainly, technically, interoperatively, getting more accurate fusion technology is something that I'm super excited about, and excited to learn more about aortic deformation. I can't wait to see how the technologies emerge for non-ionizing radiation guidance and other ways that we can use vessel guidance in the operating room that doesn't expose us to radiation.
The most pressing aortic challenges that I look forward to learn more about at Charing Cross and see the discussions about new techniques is stroke in TEVAR. Stroke is something that compromises patients significantly after endovascular repair, especially after proximal endovascular arch repair. And it is something that keep us not treating a significant proportion of our patients because we're afraid of this complication. There are some new techniques who make stroke less likely to occur during TEVAR, which is carbon dioxide flushing. I know that there's new data prepared to be shown at Charing Cross, and I look really forward to see that. I look forward to see you 2022 in person in London at Charing Cross, the reference vascular meeting in Europe.